Hello everyone, and welcome back to the Molar Academy. We're continuing our medical emergency series, and today we're going to discuss one of the most important medical emergencies you may encounter in the dental office: chest pain. When we talk about chest pain in dentistry, the two conditions that should immediately come to mind are angina pectoris and myocardial infarction. In today's lecture, we'll understand what these conditions are, how they differ, and most importantly, how to manage them safely in the dental setting. So, what exactly is angina pectoris? In simple terms, angina pectoris refers to chest pain or discomfort. It occurs when there is a temporary imbalance between myocardial oxygen supply and demand, resulting in transient ischemia of the heart muscle. Because the heart muscle isn't receiving enough oxygen, the myocardial cells switch from aerobic metabolism to anaerobic metabolism. As a result, metabolites such as adenosine, bradykinin, potassium ions, and prostaglandins begin to accumulate. These metabolites stimulate visceral afferent pain fibers, producing the characteristic chest pain experienced by the patient. Now, let's break down the different types of angina. The first, and by far the most common type, is stable angina. It is usually triggered by physical exertion, emotional stress, or anxiety, and typically resolves with rest or nitroglycerin. The underlying cause is atherosclerotic narrowing of the coronary arteries, which limits blood flow whenever the heart's oxygen demand increases. The second type is unstable angina. This usually occurs due to rupture of an atherosclerotic plaque with formation of a partially occluding thrombus, resulting in a sudden reduction in coronary blood flow. Unlike stable angina, it can occur even at rest, is usually more severe, does not resolve simply with rest, and may have little or only partial relief with nitroglycerin. Because unstable angina carries a much higher risk of progressing to a myocardial infarction, it should always be considered a medical emergency. Now let's move on to myocardial infarction, commonly known as a heart attack. In simple terms, myocardial infarction occurs when there is a prolonged interruption of blood supply to the heart muscle, leading to irreversible myocardial cell injury and necrosis. Unlike angina, where the damage is temporary and reversible, myocardial infarction results in permanent death of cardiac muscle tissue if blood flow is not restored promptly. Now let's look at the common signs and symptoms seen in both angina pectoris and myocardial infarction. Patients may present with chest pain or chest discomfort, sweating, shortness of breath, nausea, dizziness, pain radiating to the jaw, shoulder, arm, or back. Keep in mind that many patients describe the sensation as pressure, heaviness, squeezing, or tightness rather than sharp pain. Given that the symptoms can overlap quite a bit, you might be wondering, how do we differentiate between angina and myocardial infarction? To be honest, it can be extremely difficult to distinguish between the two in the dental office based on symptoms alone. However, this quick clinical comparison highlights the key differences between them. Moving on to the dental management of these patients. Before beginning any dental procedure, always take a detailed medical history. Ask about current medications, especially cardiac medications, previous episodes of angina or myocardial infarction, any history of cardiac surgery or other relevant medical conditions. Implement an anxiety reduction protocol to minimize stress throughout the appointment. Check the patient's baseline vital signs. Whenever possible, schedule short morning appointments to reduce physical fatigue and minimize the effects of anxiety. Ensure the patient has eaten, is well hydrated, and always obtain medical clearance from the patient's cardiologist before performing invasive dental procedures whenever indicated. During treatment, keep the appointment short. Avoid unexpected or stressful situations. Ensure profound local anesthesia. Continuously monitor the patient's comfort and vital signs throughout the procedure. Once the procedure is completed, allow the patient to rest before standing. Recheck vital signs if necessary, reinforce medication compliance, and arrange appropriate follow-up. Let's hope this never happens. But what if your patient suddenly develops signs and symptoms of angina during a dental procedure? The very first step is to stop the procedure immediately. Activate emergency medical services. Position the patient in an upright or semi-upright position. Administer 0.4 milligrams sublingual nitroglycerin. If symptoms persist, repeat the dose every 5 minutes, up to a maximum of 3 doses, while waiting for EMS. If the pain is still not relieved after 3 doses, strongly suspect a myocardial infarction. As I mentioned earlier, always activate EMS because in the dental office, it is often impossible to know whether the patient is experiencing angina or an acute myocardial infarction. Loosen any tight clothing. Administer supplemental oxygen if indicated. What if the patient is actually having a myocardial infarction? The initial management is very similar. Stop the procedure immediately. Activate EMS. Place the patient in a semi-reclined position. While waiting for emergency medical services, administer 160 to 325 milligrams chewable aspirin, provided the patient is not allergic and there are no contraindications. Administer supplemental oxygen if indicated. Continue monitoring the patient's condition closely. If the patient becomes unresponsive and is not breathing normally, immediately begin high-quality CPR and use an AED as soon as it becomes available. Always remember the golden rule. In the dental office, you cannot reliably distinguish unstable angina from an acute myocardial infarction. Therefore, every patient presenting with ischemic chest pain should be managed as a possible myocardial infarction until proven otherwise. Before we finish, here are a few important points to remember. If the chest pain resolves, defer dental treatment and refer the patient to a cardiologist. Any further dental procedures should only be performed after appropriate medical clearance has been obtained. If the patient has recently suffered a myocardial infarction, elective dental treatment should be postponed until the patient is medically stable and clearance has been obtained from the treating cardiologist. And that's it for today's lecture. I hope you found this session helpful. If you did, don't forget to like, share, and subscribe to the Molar Academy. I'll see you in the next lecture of our medical emergency series.